Good Saturday morning, everyone. Today on Perspectives, it's time for another COVID-19 update. Nationally, roughly 100,000 Americans are being infected every day. There are still hospitalizations and sadly deaths. Dr. Anthony Fauci had to answer questions virtually this week on Capitol Hill because he tested positive for the virus. Although vaccinated and boosted, Dr. Fauci says that he only had some mild symptoms. But as a nation, things are nowhere near what the concerns were like in the early days and in the midst of the pandemic. Health officials are still recommending, though, that we get the vaccine and the boosters as the best way to protect yourself. The CDC advisory panel is now considering both Pfizer and Moderna kid-sized formulas so that children as young as 6 months old can be protected as well. Now, some of us, though, are wondering, what are the numbers here locally? Infections, hospitalizations, and deaths. After dropping down considerably, our transmission rate, though, has gone up daily, in fact, in recent weeks. So have hospitalizations. So, who's getting infected now, and is another surge expected this summer, as several national health experts are predicting? There are still a lot of questions, and health officials will tell you that it has been a learning process the last 2 years for them, as they have worked hard to handle the challenges presented by the coronavirus. Our guest this morning, Mobile County Health Department Health Officer Dr. Kevin Michaels and epidemiologist Dr. Rendy Murphy. Dr. Murphy oversees the Mobile County Health Department's Bureau of Disease Surveillance and Control. COVID-19, what's going on now in Southwest Alabama and locally. Our conversation with health officials when Perspectives continues after this quick break. Joining us today, Dr. Rendy Murphy with the Mobile County Health Department. She, of course, is the epidemiologist who oversees the Bureau of Disease Surveillance and Control. And joining us for the first time, Dr. Kevin Michaels. He is now the health officer with the Mobile County Health Department. Dr. Michaels, welcome to the position as well as the department, and of course, following a young man who spent 30 years in that position. We're glad that you can join us, Dr. Eichel, indeed a legend. And if I can just say something that Mark told me about as we start here talking about that, public health, you developed a passion for it after having taken a class that Dr. Eichel was teaching when you were younger before going into that arena, and you were fascinated by public health.
Yes, sir.
I think that's an awesome legacy for the connection with the two of you. So indeed, welcome to Mobile County Health Department. We're talking, of course, COVID this morning, and a lot of things going on right now where people are confused, concerned, wanting to know more about what do I do now. I think I told you about my 104-year-old aunt who is still with us, just celebrated another birthday. Just found out a couple of days ago that she got COVID for the first time, but of course it's been a couple of years now, so she may have had the fourth shot, I'm not sure, but definitely the first three, and so she's doing okay considering her age, and healthy lady though for 104.
Absolutely.
But a lot of questions, you know, people want to know, well, why am I getting it now despite having the 2 shots and the booster, and some folk already have been getting the 4th shot. So let's talk initially about where we are right now, because some of the transmission rate numbers are going up, hospitalizations. Fortunately, the deaths are not really going up, but we're still having, you know, a steady amount of deaths. So where are we right now? This is June, and we're talking about the summer ahead. What's going on here locally and in our state?
So everywhere we're seeing increases of cases, and also that percent positive that we talk about. So our lowest points were in April. It's been going up since then. In fact, in May, we saw nearly 3 times as many cases reported as we saw in April. So April was our low spot. We're going up in the number of cases. More tests are positive now, around 10%, depending on who you ask. So that is 2 or 3 or 4 times what we saw at our best lows during April. We still are seeing people hospitalized almost every day with COVID diagnosis, but we still have a fairly low number of people in the hospital, though it is going up. And as you mentioned, very few deaths, but that's one of those lag measures that we talk about, that once you get infected and then you get sicker, you get in the hospital and you're hospitalized. If you don't get better, then it takes a little bit while longer before we would see any increases in severe hospitalizations and deaths.
Who are these people getting infected now? Are they people who've already had their shots and boosters, or the people who never got vaccinated? Is there a distinction?
So it's about half and half of people who are hospitalized have been vaccinated. That's higher than we've seen when the vaccines first started getting around, right? Because you have your best immunity soon after, right after, in the first 3 to 6 months after you're vaccinated is when you have the best immunity. So beyond that, you start to see a little bit of waning, and that's when we start seeing people who've been vaccinated get infected. So it happens.
Yeah, and so that's the reason why they came out with the boosters.
Right.
The boosters help the body mount another immune, prolong the immune response, and potentially protect them from infection in the community.
So when you get the booster after having received the first 2 shots, what type of time frame are we looking at where you should be fully prepared to address any of the variants that are coming in?
Yeah, usually after vaccine or boosting, it's a couple of weeks, maybe 7 to 14 days before you kind of get that full boost. And it usually will, again, we're still collecting data, remember? Sure. We're still in this
COVID
experiment.
People of that, because this is a learning in process.
Right, but usually you have about 6 months. You're thought to have about 6 months of protection. So that's why we're starting to see, FDA and CDC reevaluate the value of a booster. Starting to come every 5 to 6 months or so.
And I guess, should we talk about how even with the flu shot and other shots, people still get the flu?
That's right.
So in this case, you still have a chance of getting the virus.
Absolutely.
You do, but hopefully your symptoms will be less and you won't be as sick.
Yeah, that was the entire intent of vaccine in the beginning. It wasn't to keep people from getting infected. We know it helps, right? But the entire end point for the vaccine was to keep people from having severe illness. And so that's what we're trying to do, and it's working very well.
And see, that's the message we need to pound home, because a lot of people think that, well, I'm vaccinated, so I shouldn't have to do some of the protocols.
Right.
I should be okay.
Right.
But that wasn't the purpose. The purpose was to cut down on the amount of people that we were losing to death.
That's right, and keep people out of the hospital so as not to overwhelm our healthcare system.
I mentioned to you Dr. Deborah Birx, who a lot of people know from having worked with the Trump administration during the critical times of this. And she and some of the other health officials are talking about a surge in the summer. When you see what's happening since April, are you all expecting and looking for things to get worse, since we know that the vacation season has started now as of Memorial Day holiday? And I saw some pictures today of the Jubilee celebration in London. Did you see millions of people, it looked like, were gathering all close together? And I'm thinking, first thing, surge. What are you all looking at now and expecting to happen in Alabama and the Mobile area?
Well, we're monitoring the number of people coming in for testing and the percentage of them that are positive. However, with the availability of at-home testing, we have really no idea. If you're testing at home and you test positive, there's no requirement to report that you're positive.
And that was one of the questions I was going to ask. How comfortable do you feel that you're getting enough data right now, considering what you are working with?
Yeah, surveillance is sometimes messy, right? We know that we can't count every case under any circumstance, but what we rely on are trends. And we know that we can trust the trend analysis that we get from the cases that we do learn about, right? Are things going up? Are things going down? Is it getting worse? Is it getting better? That sort of thing. So we always, know that we're missing some cases, and we, adapt to that by, looking at the trends in our data. I think that we're worried this summer a little bit about camps and activities in children that are too young to be vaccinated, or who, the 5 to 11-year group is still the lowest vaccine coverage, like less than 15% of them are vaccinated. So I personally worry about gatherings outside of school, summer camps, sports practices, those sorts of things, even vacation Bible school and things where kids are going to get together, where very, very few of them are vaccinated. But, it's the important thing to remember is that if you have been vaccinated or you haven't been vaccinated, we also have treatments that can help prevent severe illness. So if you are vaccinated and you test positive for COVID and you have mild symptoms, please seek physician advice and see if you would benefit from receiving those oral medications that you can take at home, because it's really important that we use every tool in our toolbox to try to keep people out of the hospital.
On that, we're going to take a break, and when we come back, we're going to talk more. Our guests this morning, Dr. Wendy Murphy and Dr. Kevin Michaels from the Mobile County Health Department. We'll talk more about COVID, as well as some new things that they've just opened recently to provide more service to the community. Welcome back to Perspectives. Our guests this morning, Dr. Wendy Murphy and Dr. Kevin Michaels, Mobile County Health Department. We're talking about COVID, finding out where we are and what's ahead for the summer. I'm so happy you mentioned about those camps and the other programs like Vacation Bible School that the kids are getting together, and many of them are not vaccinated because of the percentages. So are people backing off some of those things still, or are they all for the different things that we were all participating in normally prior to COVID?
That's hard to tell. As the community has gotten, moved to the next level of COVID, I think parents are probably looking at, the kids are asking to go to summer camp and those different programs. I think that I have no numbers. I think that it's available. I would encourage it from that standpoint. The vaccination rates being low in the 5 to 11, recently the vaccine has been licensed and encouraged in that group, so it's encouraging parents to get their children vaccinated in the younger age groups.
So I was wondering if people call the health department saying, should we have a camp, or should I let my kid go to this type of camp? Just concerned about, because right now, as we were saying, there's still some uncertainty as far as how far out there do I go? Do I go into the crowd of people who are still maybe not wearing masks? Or
we get very few of those calls these days. I think that, as we've all noted, when we go into the grocery store or into a retail center, almost no one is wearing masks anymore. There's very little physical distancing. And we get some calls from places that have been very conscientious throughout the outbreak, right? They know to call us, they trust us, they know that we are here to help support them and give them the best advice that we can to keep their campers or their congregations or their patrons safe. But we don't get as many calls as we got the past 2 summers, for sure.
I'm sure.
I mean, individually they could, they can do some risk mitigation. If they're not vaccinated, get vaccinated. Remember that social distancing, respecting people's space is a good thing. Avoiding overcrowded situations, hand washing, and one thing that may be missed out there: if you're sick, stay at home.
Right.
Don't infect other people. It may be COVID, it may be nothing. But if you're feeling ill, you should stay away from others so you're not transmitting something to an individual.
Well, no, go ahead.
I was just going to say that's especially true for people who are vaccinated, because I do think there's a misunderstanding that if you're vaccinated, you're still vulnerable to infection. And if you are vaccinated, you're not feeling quite well, or you maybe have a low-grade fever, stay at home, get tested. Know before you inadvertently expose other people, particularly your family.
And you talk about family, and I'm learning. I was just thinking about my sister-in-law. She's a teacher, and she got COVID the last week of school. Oh, no. I mean, she's made it the last 2 years, and then all of a sudden it got her here the last couple of weeks, but didn't get a chance to ask her, how much of the protocol she was still practicing. But that is important. Keep that in mind, and wear your mask if you need to. Don't be shy.
There's nothing wrong with the mask.
That's right.
And you'll see in a lot of healthcare settings, there's still a requirement to put some type of facial covering on. If you come to the health department, we encourage all clients, patients, wear some facial covering. In the clinical settings, same thing. And you go to many of the other doctors' offices and hospitals, they have the same requirements. So there's nothing wrong with it.
That's right. I have no problem putting mine on. I'm one of the few people you may see at the grocery store still with it on, because for me, not knowing exactly what's going on, and I don't want to have to deal with it, so I'm going to do some of the basic protocols. So let's tell people right now what they should be doing as we enter this summer season, just some of the basic things to do, to practice, to hopefully prevent getting COVID.
Yeah, it's never too late to get vaccinated. You could get it free at the health department. Walk in, don't even need an appointment. If you have high risk for severe complications of COVID, consider your personal risk before you enter into a situation outside of your home, right? Consider masking, consider distancing, wash your hands, stay at home if you're sick. Don't go to an indoor gathering if you're at high risk of complication if you get COVID. If you do have symptoms of COVID and you test positive, call your healthcare provider. Try to get some oral treatment, right? We have lots of layers that we can peel on as we start seeing the community transmission increase like we're seeing right now.
And the fourth booster, is everyone eligible for that, or how does that work?
It's the high risk people, over, typically over age 50, with other health complications.
So they need to
right.
come to you and bring some information, or how do they qualify?
Yeah, if you don't have your vaccine card, we can look it up if you were vaccinated in Alabama and if the person who vaccinated you entered the information as they should. But if you're 50 and over, then you're eligible for a second booster. For everyone else, a single booster is authorized for 5 and over. And then the FDA is going to be meeting in June. I think they have 3 meetings around COVID where they're going to be considering a new COVID vaccine from another vendor. They're going to be considering vaccination for 6 months to 5, and considering Moderna boosters, because right now most of the booster eligibility down to 5 is Pfizer. So lots might come available in June that parents could think about.
We've got a couple of minutes left. Let's talk about the new location and how that's another area for you to have for the community to take advantage of this.
Well, we have the Festival Center. We have our clinic up in Sims offering testing and vaccination. And we recently opened, we put another component onto the Southwest Health Clinic.
Right. And that's in Tillman's Corner?
Tillman's Corner.
Okay. And so give us an idea of what's available there now, because in talking to Mark Bryant, the information officer, he was very high on what is available for the community to take advantage of there.
Yeah, at all 3 locations we offer testing by appointment, so no cost, no out-of-pocket cost for anyone who needs a rapid antigen test. So you walk in, get tested, you leave with your test result, which is very appealing to people.
That is.
And then also you can walk in and get either Moderna or Pfizer, get your first, second primary series or your booster. So we have all the products available. The only thing we do not offer anymore is the Johnson & Johnson vaccine. It's recommended that
the one shot.
That's the one shot, right? And we're not able to order that one anymore from the federal government, so we can't offer that to people, but we do have Moderna and Pfizer. And like I said, right now it's pretty, if you walk in, you can get an appointment even if you didn't make one. So come on out, and we're happy to help.
Yeah.
And for those people that are in doubt where they are in the series, the CDC has a little algorithm. You plug in your age, what the last shot that you had, and it'll tell you the window period where you can get the next vaccination to kind of help steer you if you don't have your card.
And these services are free.
Yes.
Right, no out-of-pocket cost. We are still going to ask you for identification. We're going to ask you if you have insurance. We'll collect your information because we may be able to recover what we call an administrative fee, but these services are at no cost to the client.
That's excellent. Well, I thank you both for coming today and trying to clear up some of these points for us that people are asking and curious and concerned, and hopefully this will motivate more folks to get what they need as far as vaccinations or practice the protocols that we should be practicing if we are concerned about the environment. I know there are weddings taking place, and I was so glad that you mentioned the camps. So many of those are going on. So it's a busy time of the year.
It is.
And we've got to be careful, though, and keep COVID in mind.
And many of the activities are outside.
That's a plus.
Which
That will
is a
help.
lower risk.
Yeah.
You know.
Okay, that's a plus. Thanks for mentioning that. Indeed. All right. Well, Dr. Kevin Michaels, our new health officer for the Mobile County Health Department, and of course, Dr. Randy Murphy, always glad to have you here and shedding light on clarification of these different points for us.
Thank you, Aaron.
All right. Thank you both very much, and we thank you for joining us on Perspectives.
Thank you.
Now, to contact the Mobile County Health Department, you can go to their main location at 251 North Bayou Street in Mobile, or there's a number to call as well for more information, 690-8101. And also go to their website for all the information on these new locations, as well as the shots and what information you need to bring. You can go to mchd.org. They also have an area there for COVID information as well. Well, next up on Perspectives, how does a community come together to end youth violence? The numbers are extremely disturbing and heartbreaking. 11-year-olds and infants who are now the latest victims. Now, even if they were accidentally wounded by a stray bullet, the questions are, who was shooting and why? We talk with officials from Operation Echo Stop and Community Days events on their plan for change. Well, thanks for joining us here, always on Saturday morning at 9 a.m. for Perspectives, as we discuss those important issues and seek solutions. I'm Eric Reynolds. Thank you so much for joining us. Have a great week ahead, and we'll see you next time.
Thanks for watching Fox 10 News. Watch us live wherever you are, on our mobile, our streaming news app, and you can also watch us on Roku, Apple TV, and Fire TV.